All right, today we're diving into one of the most frankly shocking chapters in all of medical history, the lobotomy. I mean, think about this. This was a procedure that actually won its inventor a Nobel Prize. It was praised as a miracle cure and performed on tens of thousands of people, only to become a symbol of, well, medical barbarism. So the big question is, how on earth did the world get it so wrong?
To really get a handle on the story of the lobotomy, you have to start right here, with this central contradiction. You're looking at a poem written by a patient back in 1942, and it's full of just profound gratitude. So how? How could an operation that we now see is just horrible have been viewed by some as a life-saving miracle? Well, the answer really starts with just how desperate the state of mental health care was back then. So, okay, what exactly was a lobotomy? Well, at its core, the procedure, sometimes called a leukotomy, was a type of brain surgery. And what it did was sever the connections in the brain's prefrontal cortex. That's the part of our brain that basically governs our personality, our complex thoughts, who we are. And you have to remember, this was an era of just overflowing asylums with almost no effective treatments. So this radical idea, it didn't just seem plausible. To a lot of people, it honestly seemed like the only hope they had.
And if you're looking for proof of its legitimacy, look no further than 1949. This was the absolute peak of its popularity, and the guy who invented it, a Portuguese neurologist named Egas Moniz, was awarded the Nobel Prize in Medicine. Let that sink in. This wasn't some fringe back-alley treatment. It was being celebrated at the absolute highest levels of a scientific world.
So, where did an idea like this even come from? I mean, the concept of surgically fixing a person's brain, it didn't just appear out of thin air. It actually started where a lot of scientific leaps do, with experiments on animals. And in this case, we're talking about chimpanzees.
Okay, so the story kicks off back in the 1930s at Yale University. There's a physiologist there named John Fulton, and he's studying primate brains. He ends up performing what are called frontal lobotomies, that's literally removing the frontal lobes, on two chimps, Becky and Lucy. Now, before the surgery, Becky was known for having these, violent tantrums anytime she failed a task. But after the surgery, her entire personality just changed.
Fulton reported that these aggressive, anxious chimps suddenly became placid and calm. His words were that it was as if they had joined a happiness cult. They just weren't frustrated by their mistakes anymore. And this one observation, the idea that you could sever connections in the frontal lobe and just eliminate distress, well, that planted a very powerful and, as we'll see, a very dangerous idea.
Now, sitting in the audience for Fulton's presentation was that same guy we mentioned earlier, Egas Moniz. And as he's listening to this story about the pacified chimps, he makes this fateful leap in logic. He thinks, wait a minute, if this procedure can calm down an agitated animal, why couldn't it work for severe mental illness in humans? And get this, just 3 months later, he was already putting that theory to the test.
So Moniz's theory went something like this. He believed that mental illnesses like psychosis weren't caused by any physical damage to the brain. Instead, he thought it was because destructive thoughts were getting stuck in these fixed, repetitive circuits. It was like a broken record in your head. So he figured if you could just physically sever those nerve fibers, you could literally break that feedback loop and, set the patient's mind free.
Now, Moniz might have invented the procedure, but it was actually an American doctor who took it and turned it from this niche surgery into a full-blown phenomenon. And he did it by developing a new method that was way faster, way easier, and, as it turns out, far more brutal.
And that brings us to this guy, Walter Freeman. Now, Freeman was a charismatic and, you could say, a pretty zealous doctor. He looked at the state of American mental hospitals. They were overcrowded, seriously underfunded, and they just had very few real options for patients. And he became absolutely convinced that the lobotomy was the answer. He wasn't just a doctor who performed the procedure, he was like an evangelist for it.
See, Freeman's first partner was a real neurosurgeon, and their procedure was the real deal. It required drilling into the skull in a proper operating room. But for Freeman, that was just too slow, too complicated, too inaccessible. His vision was for something more like an assembly line lobotomy, a procedure so simple it could be done in minutes by any psychiatrist in any asylum. No fancy surgery required.
And this is what he came up with. He got the idea from an Italian doctor and developed what he called the transorbital lobotomy. This new method just completely abandoned drilling through the thick skull. Instead, he figured, why not access the brain through the thinnest point of bone you can find, which just so happens to be the back of the eye socket.
The steps were, well, they were brutally simple. First, the patient was usually knocked unconscious with electroshock. Then Freeman would lift up their eyelid and insert a sharp instrument. He called it an orbitoclast, but it was literally a modified ice pick, right up into the eye socket. A quick tap from a mallet would break through that thin bone, and then he just swished the instrument back and forth to sever the connections in the frontal lobe. Repeat on the other side, and the whole thing was over in less than 10 minutes.
And thanks to Freeman's tireless, almost non-stop promotion and this super simplified technique, the number of lobotomies just exploded. We're talking huge numbers. In the United States and the United Kingdom alone, it's estimated that over 50,000 people had this procedure done to them.
But, behind those staggering numbers and the shiny Nobel Prize, there was a really devastating reality. For the patients themselves, what was the actual outcome of this so-called miracle cure? Look, the procedure was sold as this amazing cure for things like anxiety and psychosis. And okay, yeah, it often did reduce agitation. But the cost was a complete flattening of a person's personality. Patients became apathetic, passive. They just lost all initiative, all drive. Freeman himself had this chilling phrase for it. He called it a surgically induced childhood. The patient wasn't really cured. They were just made docile, easy to manage. And that's not even mentioning the seizures, or the fact that for about 5% of patients, the operation just killed them.
Probably the most famous case you've heard of is Rosemary Kennedy, President John F. Kennedy's sister. When she was 23, her family was getting worried about her mood swings and what they called her rebellious behavior, so they approved a lobotomy. The operation was an absolute disaster. It left her permanently incapacitated with the mental function of a small child, and she spent the rest of her entire life institutionalized, pretty much hidden away from public view.
I mean, Freeman's own notes, they reveal the really chilling goal of his work. He's describing one 29-year-old woman, and he wrote that the operation created a smiling, lazy, and satisfactory patient with the personality of an oyster. Wow. The goal wasn't to restore a person's life. It was to create a satisfactory patient, and by satisfactory, he just meant manageable. The person's actual personality? That was completely secondary.
So how did they justify this? Well, with data that seemed successful. An early study from Freeman and his partner reported that 63% of patients had improved. But you have to ask, what did improved even mean? It was a really subjective term. Often, it just meant the patient was quieter, less trouble for the staff. And even if you take their numbers at face value, that still means over a third of patients were either no different or they actually got worse.
So, the question is, how did this whole era finally come to an end? And, more importantly, what lessons can we, and should we, take away from this really dark period in medical history?
The thing is, the procedure's rise was incredibly fast, but its fall was just as quick. Criticism really started to build up through the late 1940s. The Soviet Union actually banned it as inhumane way back in 1950. But the real death blow, the thing that really ended it, came in 1952. That's when a new drug, chlorpromazine, was introduced. It was the first truly effective antipsychotic medication. And just like that, finally, there was a better, safer alternative. By the 1960s, the lobotomy was pretty much a thing of the past.
So when you look back on it, the story of the lobotomy is just this profound cautionary tale, right? It's a huge warning about the dangers of medical hubris, about how desperate people can get for a miracle cure, and it really shows what can happen when a radical treatment gets pushed forward without any rigorous evidence, especially when the patients are society's most vulnerable people. And all of this leaves us with one final, kind of unsettling question. You see, the doctors who perform lobotomies, they weren't monsters. Many of them genuinely believed they were helping people, alleviating suffering with the best tool they had at the time. And that really forces us to ask ourselves, what widely accepted medical breakthroughs of today will future generations look back on with absolute horror?